Hello and welcome to the final video in a 5-part series around postural management. My name's Richard and I'm the Clinical Training Manager for Jiraffe and for Jenks. So just a bit of a brief overview of why we've put this series together. It's really an introduction to postural management that's aimed at anybody that's involved in the care of somebody with disabilities. So we've taken a look at the importance of a 24-hour approach to postural management. We've had a look at the body itself and our anatomy and biomechanics. We've also looked at the risks associated from adopting a poor posture and what secondary complications can occur. The latest video was around how to build a stable posture in seating, standing and lying. But today we're going to take a look at the fundamentals of assessing someone's posture, and from that how to go about recommending equipment from those findings. Just a little bit about me. My name's Richard. I'm the Clinical Training Manager for Jiraffe and for Jenks. Prior to working for Jiraffe and Jenks, I spent around 8 years working for the NHS, and that was in a variety of different roles in different settings. I've got a great deal of experience assessing people's posture, especially those with complex disabilities, and that's led to the recommendation of provisions in seating, standing, lying, and bathroom and mobility. I also have a postgraduate certificate in postural management for people with complex disabilities. So, as I mentioned, today's presentation is on assessing posture. Some of the things that we're going to look at today and some of the outcomes that I hope you will get from this presentation. We're going to take a look at a 3-stage approach to assessing an individual's posture, and we're going to delve into the importance of why that needs to be such a thorough assessment. Now we'll have a look at the physical side of the assessment. Unfortunately, via a webinar, it's going to be quite challenging, but I hope that you'll pick up some of the practical tips and things to consider and the principles that we look for when we assess someone's posture. Then from those findings, we'll be able to analyse them and put together a bit more of a clinical reasoning and rationale of why we might need to recommend certain equipment provisions. So where do we start? You have a quote on this slide around assessment and the importance of that, especially for healthcare professionals that are coming into contact with a disabled person. It's really the first step in rehabilitation, or in our case, the management of someone's posture. As I mentioned, we're going to take a 3-step approach to our assessment. So the first stage is the pre-assessment. So we need to gather as much information about that individual as possible. We'll then move on to the physical side of the assessment, looking at ranges of motion and different body segments and how aligned or how not aligned they are. And from all that information, we'll evaluate it, and from that we'll see if we need to recommend any equipment provisions. So if we move on to the first stage, which is pre-assessment, I've broken this down again into 3 different categories. And the first category we're going to look at is the medical history of that individual. So has that individual had any past surgeries, or are there any future surgeries that are coming up? It's really important from a postural management point of view that we understand this. For example, if someone's going in for a hamstring lengthening surgery, it's really important that we've got in place a plan to manage the length of that hamstring after the surgery's happened. We spoke in a previous presentation around the importance of treatment versus management and how they should work together. So for that surgery to be successful and to be more effective, we need to really manage what happens after. Also, we need to think of any medication that's been taken. So, for example, baclofen to manage any tone issues or any pain medication. We need to understand the person's diagnosis and their condition, and also where they sit on the gross motor function classification scale, as that's going to give us an indication of their ability currently. Are there any skin integrity issues? Now, this could be related to pressure or the thinness of someone's skin. And if there are certain pressure-related injuries, we need to consider this in different positions and what's going to be achievable. Are there any previous injuries, such as fractures? We're already aware that people with severe neurological conditions take longer to recover, and how that might fit into a 24-hour postural management plan. Are there any known contractures which may limit the range of motion of any joints? We understand now that in seating, we'll always look for a 90-degree angle at the hips, the knees and the ankles, and whether there's anything that's already going to stop us from being able to achieve that. Are there any respiratory problems? So do we need to take into consideration being in different positions? For example, if someone's in a supine position where they're lying flat on their back, they may require their chest to be elevated. So maybe a profiling bed might be appropriate for that person. What about the nutritional intake of that individual? Is there a peg site that we need to be mindful of when we're putting supports into place so that we don't catch that site? Are there any issues around toileting or continency? If someone might be learning to use the toilet for the first time, it might be that we need to support them over the toilet in order to allow their body to do what it does naturally. Are there any neurological issues such as muscle tone or any retention of primitive reflexes like the asymmetric tonic neck reflex? Is there any lack of sensation and the communication level of that person, whether they're able to tell us that or not? And finally, we need to think about any orthotics that are in use, so any knee or ankle foot orthotics or any kind of nighttime positioning aids that are used. The second category that we're going to look at in pre-assessment is the social side of that individual. So who's involved in that person's care? Do they live at home? Are they at school or a day centre? Is there carers involved? It's really important that we understand that everybody that is involved in that person's care, as when we look at postural management, it's over a 24-hour period. So it's going to involve everybody that comes into contact with that person each day. How about the communication level of the person? Are they verbal or non-verbal? Do they require eye contact to be able to communicate, or do they use a device in order to be able to communicate? So when we choose equipment provisions, we need to be mindful that we're able to use these devices with the equipment provision. Attending schools or a day centre. So is the correct equipment in place at that school? Is there any duplications that need to happen? Is the staff on board and understand why it's so important that we use the postural management equipment? Is there any training that might need to be happen around that? The person's personal care needs, are they independent? Do they require a lot of assistance in attending to their personal care needs? You'll remember that one of the three main aims of postural management is function. So we always need to make sure that whatever intervention we put into place, it doesn't impede that function. So if a piece of equipment will stop someone from attending to their personal care needs or activities of daily living, we need to consider that quite carefully. So what are the person's hobbies or interests? We want to promote as much independence as possible to help them develop their social skills. From good positioning, it's going to help them to access their hobbies and interests more as well. So what are the aims and goals in relation to their therapy, family, or educational goals? So this may include motor skill development, social development, engaging in classroom activities or hobbies and interests. They might be part of the MOVE programme where they can develop their motor skills further, or any educational goals. We also need to take into consideration any current postural management regime to really assess and review what's going well and what might need to be changed. The third category in pre-assessment is the individual's environment. So we need to think of the living situation itself. Is the home on a level access, or are there multiple stories? And if so, is there access to a lift? How about the home layout itself? Is there any issues going from room to room, or any thresholds from leaving the home to go to school, etc.? The space available in the home is also really important to think about, as we know that some of the equipment can be quite large, and some individuals may need multiple pieces of equipment. So will all of this equipment fit in the home? Will it be used? Will it be engaged with the family? Are there any toileting or bathing needs? And in terms of the bathroom itself, is there enough room for a shower chair or an adapted bath? And do we need to think a little bit outside of the box of how we can help that person meet their personal care needs? Are there any transport requirements? So for getting to school or day centre, or engaging with any hobbies and interests, is there any safety issues in leaving the property, and what kind of transport are we using to go from A to B? And in terms of the school or day centre itself, is it an adapted school, such as a special school, or is it a mainstream school that we're going into where we might need to take further considerations of accessibility into consideration? We also need to consider hobbies and interests and visiting extended family. Are there any other access issues there that we need to consider, and how are we transporting from A to B? And also, just to reiterate, anything that we put into place in terms of an intervention and for managing someone's posture, we need to make sure that we don't impede anyone's independence or function, as that is the paramount thing that we need to consider. So now that we've taken a bit of time to collate all of that information, and I know it's a lot of information to think of, but the bigger picture that we get, and the more that we understand about that individual, the more holistic approach we can have to managing that person in a 24-hour period. Now we're going to move on to the next stage of assessment, which is physical assessment. On your screen here, we have a quote from Pauline Pope, who says, "The purpose of an examination is to provide a physical profile of the disabled person in terms of the positive factors, or their ability, and the negative factors, which are the secondary complications, from which the physical status can be determined." So if we simplify that language, it's basically saying from assessing someone's ability, we can find out what they can do and what they can't do. And from that information, we can better help someone. Now, there's just a couple of things that we need to consider before starting a physical assessment. And the first thing is that we need to observe someone in both sitting and in lying. Now, it might sound a bit counterintuitive to do this if perhaps we're going into an assessment of a child for a new seating system. However, to get someone's true reflection of their ability, we need to see them in both positions. If we only observe someone in one position, we're not going to know exactly their full potential, and from that we might be actually limiting their abilities. And we really need to take this holistic approach to 24-hour postural management. So it's not just a seating system. That's part of someone's regime and some part of someone's postural management plan. But there are multiple different positions that person's going to maintain throughout the day, and we do need to consider those no matter what we're assessing for. So now we're going to move on to look at some of the different body segments and how to really measure someone's posture. So in previous presentations, we've gone through anatomy, and I've mentioned things like having a neutral pelvis or a level pelvis. But how do you really know if a pelvis is neutral or level? So we're going to go through that first. So as you can see on this slide, we've got a pelvis and the word ASIS, which stands for anterior superior iliac spine. So what we're going to do with our thumbs is we're going to palpate the pelvis, which you can practice on yourself now, and try to locate those bony reference points. Now, when I was studying my postgraduate course in postural management, our tutors did tell us that if you are unsure whether they are the ASIS, it's absolutely fine. The idea is that we're looking to find a bony reference point on one side of the pelvis and find the same bony reference point on the other, because for the purpose of what we're going to do, it's all about whether it's the same level, basically. So if we look at pelvic tilt, once you've located your bony reference point on your pelvis, as you can see, if the pelvis is neutral position, your thumbs will be in a nice kind of thumbs up position. If the pelvis is very small, if you are assessing a small child, you might be able to feel the back of the pelvis with a PSIS, which is a posterior superior iliac spine, and you'll actually be able to tell whether that's level with your little fingers or another finger. Now, if your thumbs are a little bit pointed towards yourself, that will mean that the pelvis is in a slight anterior tilt. And if your thumbs are a little bit towards the user, then it's likely that the pelvis is in a posterior tilt. Now, another little tip around this is having a look at the lumbar spine. So if you sit yourself now in a posterior tilt or a sacral sitting position, and then if you try to feel your own lumbar spine, so just above the pelvis, you'll notice that it's very flat. Now, if you sit back nice up in your chair and feel that lumbar spine again, you'll notice that you've got a nice natural curve. So that's again an indication of whether your pelvis is tilted or not. So if we're looking for a pelvic obliquity where it's higher on one side than the other, you can see here on the slide that this is actually the back of the pelvis, so we're looking at the PSIS. However, on the front of the pelvis we can do the same thing. So again, if we palpate the pelvis to find your bony reference points at the front, and once you've found those points, you'll be able to tell which thumb is higher than the other, or if they're level. So for example, if one's higher on the left, and then if you put your thumbs together, you'll notice that there's a degree of difference between your thumbs. So when we look at pelvic rotation, the same thing applies. So finding those bony reference points on the front of the pelvis, and then this time you'll notice that one thumb is in front of the other. So again, if you bring your thumbs together, there'll be a gap in between your thumbs. So that amount of gap will tell you if the pelvis is rotated. Another way of doing this is taking a look at the legs. As you can see on this slide, you can see that the right leg, the right knee is in front of the left one. Oftentimes this can be kind of misdiagnosed as a leg length discrepancy. So this is one of the really important reasons why we need to find out whether that's just a rotated pelvis or if there is a leg length discrepancy from, for example, a subluxed hip or a dislocated hip, or a congenital problem. So now moving on to the top section of the body. So how do we know if the top section is level? So we need another bony reference point. And this time we're going to use the coracoid process. So that's located underneath the clavicle or the collarbone. So if you have a go now of just feeling where that might be on yourself, if you follow your clavicle and then just under that, just before the shoulder joint, you'll feel a bony reference point, and that's the coracoid process. Now, just to be mindful that some people feel a little bit queasy when you actually press on that, so make sure to be quite light when you are doing that with your clients. And again, the same thing applies. So once we've found those two bony reference points, we're going to be able to tell if there's any obliquity or one side higher than the other. And then again for rotation, so is one thumb closer to you or further away from you than the other? So now we've taken a look at the pelvis and finding bony reference points in order to tell us whether there's any rotation or obliquity or tilt. We've also taken a look at how to measure what's happening at the upper part of the body using the shoulders as a reference point. Now there is another presentation that's available around anatomy and biomechanics, so if you need a bit of a refresher on what internal or external rotation means, or abduction or adduction, then please take a look there in order to help refresh your memory. So before we move on, we have a postural assessment tool here that's available for use in your assessments. I just want to state that this is in no way replacing a full postural assessment. This is an adaptation of a small section of the actual assessment that's taught at the Oxford course. So by no means would this replace that assessment, and you should always have a full postural assessment of the individual. So now if we take a look at the assessment tool itself, as you can see, the top section of this tool, you've got on the left hand side, it's all structured around the pelvis and the lower limbs, so it's about creating that stable base. So as you can see, we've got rotation, obliquity, any pelvic tilt, and what's happening to the lower limbs, whether they are abducted or adducted, and if there's any internal or external rotation. And then next to this, you can see we have a column for presenting in sitting and presenting in lying. So we will go through the assessment and find out, using those bony reference points, what's happening to the pelvis in both sitting and in lying. Now, just some things to point out when you are doing this assessment. First of all, we need to assess in the current seating system that the person is using. So we want to get them in the best and most comfortable position as possible, using all of the supports that are currently on the chair, to really gauge whether they are working or whether it needs to be reviewed, and if any additional supports need to be added or taken away. It's also important to take a look at what's actually on that current chair and what kind of materials are being used. So for example, they might have a different kind of material used in the cushioning, so it might be a gel or a fluid material, and this might be related to some kind of pressure related issues. And having that as a bit of a robust background of what's currently being used will also aid you in making your recommendations after the assessment. It's also really important to take note of any leaning or slumping that might be happening in the seating system, and this is because it may also relate to any pressure going through different parts of the body. Now we're going to come back to this form and actually give you some examples of how to fill it in, and the kind of information that you can gauge from using this form, and assessing and reviewing the positions and the presentation in both sitting and lying. Now the bottom section of the form is all about the upper half of the body. So as you can see there, we're looking whether the shoulders are rotated or if there's any obliquity, and if there's any possible spinal curve in any section of the actual spine. And we're also going to take a look at any head positioning, as we already realised that this is really important in postural management for things like swallow and communication. So in terms of the actual spinal curve, this is actually at this stage just an observation of what we feel might be happening. So if I give you an example, if we find that on one side of the pelvis we've already found an obliquity, so it's higher, for example, on the left hand side, and then when we've measured the shoulders it's also higher on the left hand side, that might indicate that we've actually got a bit of a C-shaped scoliosis happening. So it's just things to consider. But really, at this point of the assessment, it's just what could be. It's by no means a science. It's a bit of a subjective idea of what's happening. And in terms of when we think of the head, is it in a functional position? As we've mentioned in many presentations before, whereabouts is our eye contact coming from? If we are in a position where we're looking at our knees constantly, we're not able to engage with our surroundings as much. Another thing to be aware of is any loose clothing, and this can give you a bit of a false reading as well. So that's another reason why we need to be very thorough in using some of the tips that we've gone through around palpating the pelvis to find the bony reference points. And also one thing that we need to make sure to do as well is just to feel all around the lateral borders of the body to find out if there is any pressure going through different body segments. So if you can get hold of any slide sheet gloves, these are really useful because it means that you can get under your client to really feel what's happening under kind of their thighs, in between their the different sections of the spine, and really feeling everywhere around the body, for example shoulder blades, back of the head, just to feel if there's any extra pressure going through different parts of the body or whether it's equally loaded. As you can see on this slide, we have filled in some of the assessment tool for you as in a way of a bit of a mock assessment to give you an idea of how to use the form. So if we look at pelvic rotation, so we've palpated the pelvis and we've found that on the right hand side we're coming forward by about 3 centimeters. So this is a bit of a guesstimation really. So again, this isn't a science. You need to use your own observational skills for this section. So really we're guessing that the rotation, once we put our thumbs together, so we found that the gap between our thumbs is around 3 centimeters, so we'll put 3 centimeters there. Then we found in a supine position in lying that there is no rotation and it seems to be completely neutral, so we've put that into the next section here. On the obliquity side of the pelvis, we felt that on the same side that we're rotated forward, we seem to be up about 5 centimeters. We've done the same in lying, and we've noted that it's about the same, so it's about 5 centimeters higher on the right hand side. And as you can see, we've gone through the form to fill those in, some of which are the same in sitting and some are different in lying. So if you continue with the assessment tool here, you can put into each box what you found. For example, on the lower limbs here, we've put that the right leg seems to be neutral in both adduction and abduction, and also there doesn't seem to be any internal or external rotation. We've noted that the left one seems to be a bit more abducted and there seems to be quite a bit of internal rotation. So if we work through that form, and we can put our findings for both sitting and lying in there. However, we're going to come back to how to measure the findings and how we can make recommendations from that finding in just a second. Now that we've filled in the postural assessment tool and we have that information, it's time to take a look at the individual's range of motion. As we are already aware, we need certain ranges in order to be able to achieve certain positions. So the method here, the neutral to zero method, is the same method that's taught on the Oxford course where I did my postgraduate course. So I would advise that you get hold of this book, as it's a really simple method in measuring range of motion. Unfortunately, we don't have enough time to go through everything via this webinar, so I would refer to that book in order to learn how to take someone's measurements for range of motion. So let's just remind ourselves of why it's so important to measure someone's range of motion. So we know that we need to achieve certain angles in order to be in different positions. For example, seating, we look for the 90 degrees at the hips, knees and the ankles, and in a standing position we want to be as extended as possible, and that's to do with the amount that we can weight bear through our hips, knees and ankles safely. We also need to make sure that we're lying well to sit well. So in a previous presentation we spoke about the idea of being in a windswept position and how that can affect us when we're in a seated position. We also need to take a look at the lower limbs as well, and if there's any abduction or adduction, as this can create instability, as well as any internal or external rotations. As being too severe, this may affect how or what kind of equipment provisions are available to an individual. So now if we just jump back to the postural assessment tool and how to really utilize the information that we have. So if we take, for example, the first section around the pelvis, so let's look again at the rotation. We found that on the right hand side we were forward 3 centimeters, but when we were in lying, this was we were able to get a neutral position. So what this is telling us is that is likely to be quite a flexible issue. So what's happening in the seating system with the rotation can actually be corrected. So this will help us in recommending what this individual would need in a seating system. Now, if we take a look at the pelvic obliquity, we can see that on the right hand side of the pelvis we were up by about 5 centimeters, and in a lying position again we were up by about the same amount of the same 5 centimeters. So what this may indicate is that is possibly a fixed obliquity. So in seating, what this means is if we have a fixed obliquity, then it may limit what kind of equipment we're looking for and how we need to support that pelvis. So if we do have a 5 centimeter obliquity, for example, we may need to use more of a molded approach to that seating system, so that we are adequately shaping the seat around that person's obliquity in order to make sure that it doesn't get worse, but also to make sure that the amount of pressure that's going through the pelvis is nice and distributed throughout the whole pelvis. We can look further on in the form and see that we found that the pelvis was slightly posteriorly tilted in seating. However, again in lying we found that this was in quite a neutral position. Again, this would indicate that it's more of a flexible issue, so again that can be corrected in a seating system. So again it may indicate what we look for in a seating system. For example, possibly this individual may benefit more from a sacral block with a 4-point lap strap to really help to secure that pelvis in a neutral position. So it's really important to make sure that we are doing that, as if we leave that person in a posterior tilt whilst in their seating, over time that flexible issue may become a fixed issue. So as you can see, throughout the rest of this form, we've continued with that approach of measuring what's happening in seating against what's happening in lying to tell us whether something's possibly fixed or whether it's nice and flexible. Now, if we take a look at how we're going to evaluate and what we can recommend, as we've mentioned in the postural assessment tool, we can figure out if something is flexible or if it's possibly fixed. So if something is flexible, we always look to correct it wherever possible. However, we need to take into consideration comfort and pain. If something is too painful to be completely corrected, then we need to adjust that, because we don't want to promote pain and discomfort, and also it's going to make someone less likely to tolerate that certain position that we're looking to achieve. So therefore we might need to take a gradual approach to this and effectively bring in different supports over amount of time in order to correct that asymmetry, but also make sure that the user is also nice and comfortable. So we always look to stop the formation of contractures as well. So if something is flexible, that's one of the main aims of correcting something, is so that we don't form those contractures, and the idea of bringing that back into alignment. And also we want to maintain as much range of motion as possible as well, to achieve multiple positions, which we've already spoke about previously. Also, if we found from our postural assessment that things are likely to be fixed, our approach needs to change of what we're trying to achieve. So we're trying to actually manage that asymmetry so it doesn't get worse. So this may require using more of a moulded approach. We spoke previously about the idea of the pelvic obliquity and how we need to mould around the pelvis and the lower limbs in order to disperse pressure. This is one of the benefits of a kind of a moulded system, where the more surface area of the individual that you cover, the more evenly that the pressure is distributed. However, with a moulded system, there's often a more detrimental effect to function as well. So with a more off-the-shelf bespoke option, you may be able to have more independence. However, the clinical reasoning for having kind of a moulded seat may outweigh that. We also need to maintain as much range as possible in joints, even if there are kind of fixed problems and contractures. We need to go through as much of a range of motion as that limb will allow, so that we don't create more of a shortening of any tendons or ligaments as well. So if somebody does have a limited range of motion, it doesn't necessarily mean that we won't be able to achieve certain positions. It just means that we have to take that into consideration when choosing an equipment provision. So, for example, if someone cannot reach those 90 degrees that we look for in seating, it might be that we require the foot plate to be set further back or further forward. We might need the backrest itself to be able to open up to a wider angle, because we can't quite reach the 90 degrees at the hips. So there's things to consider there, obviously shear force, things like that, and how we might use tilting space to accommodate those angles. But it will also determine what kind of a piece of equipment that you'll need to recommend as well. So it's something that we just need to consider. So if there is a great deal of fixed asymmetries, it might be that we look for more of a moulded seated system. However, if we're looking to correct a lot of asymmetries, that's kind of more of your off-the-shelf modular products that we might need to look at. So things where we can bring scoliosis back into alignment, things where we can manage abduction at the legs, and any internal or external rotation. So it's good to understand what you need before you start looking for equipment as well. So it's best to have a list of everything that you need from that system. So once you have gone through your postural assessment and you found any limitations in range of motion, any asymmetries, or anything that needs to be corrected, you can then start creating a wish list of things that you need from that system. So you may need offset laterals, you may need some guidance at the knees in order to manage abduction. You may need the back angle to be able to be extended to come out of a 90 degree option. You may need a headrest that manages side flexion. So those sort of things. So once you've got that list of everything you need from that seating system, you can then take that and approach kind of the industry to find out what pieces of equipment are out there that would meet the needs of your client. It's really important that we take a holistic approach as well. So ensuring that we are considering the whole 24-hour process. So although we may only be doing an assessment for a seating system, that's only one position that we're looking to achieve. We need to maintain the range of motion in order to get into a standing frame, for example, or what kind of nighttime positioning may also be needed. We need to take a look at the pre-assessment information that we've gathered as well, so any aims or goals or restrictions that might be in place and things that we need to accommodate around the person's environment or social issues. And then we do need to consider that everything that we do needs to fit around those three main aims of postural management. So if we are putting a provision into place, we need to ensure that we are maximising function, minimising damage, and reducing fatigue. And as we've mentioned, that has to happen over a 24-hour process, so nighttime positioning is also included within that. So in summary, we've taken a look at a three-step approach to assessment. We've looked at a pre-assessment, so gathering as much information about that person as possible. We've looked at the physical assessment side of things and given you some tips and some strategies of how to assess someone's posture in a physical way. We've also looked at how to evaluate that information and be able to make recommendations based on those evaluations. We know that the individual's needs are not just postural, it's a holistic approach that we need. So we need to take into consideration any social issues, any medical needs, also someone's hobbies and interests and what they want to do in their day-to-day lives. Everything needs to be encapsulated into one vision. We've got the postural assessment tool available on our website as well. So just to reiterate, this is not to replace a full postural assessment. This is only a small section of your postural assessment, and it's just a tool to help you in gathering that information. We've given you some tips and some techniques in how to find bony reference points on the body in order to find out if something's rotated or if there's obliquity or any tilt. We've looked also at the reasons why range of motion is so important in creating different positions and how that feeds into equipment provisions. And from all this information, we've kind of thought about how to make recommendations and things to consider before kind of approaching an equipment provider. So thank you again for listening and for attending this last webinar within the series. The rest of our webinar series are on our YouTube channel, so please do take a look at those. And please refer to our website for any further information on the educational side of things that we have and also the product range that's available. Thank you very much.